So my journey into understanding the opioid crisis started out here in East Tennessee, which is my home. But if you take a look at these mountains here, these are the mountains where my family has come from in South Korea, and they look very, very similar to the mountains here in East Tennessee. My father chose this area to study because there was not a lot of economic opportunities after the war, and like a lot of immigrants searching for a better place, why not pick a place that was very similar to the areas that you've lived in before? So he traded one set of mountains for another, and here in East Tennessee. And so when in 1967, when he decided to come over here, he brought his fiancée over and got married at the church over on Methodist, at the Methodist church over on Henley Street. And when you have two mountain people from the hills of Korea come here to a new set of mountains, this happens. And so, like I said, this is my hometown, Knoxville, Tennessee. And back in 1977, and all through the first 18 years of me growing up in this area, I remember a different type of Knoxville from the one that we are here today presently facing. And so during that time, as I was growing up, I didn't realize there were a lot of historical and cultural forces that really set up the backdrop to where we were today. And then as I was getting my education from college to medical school and my final residency and fellowship, during that span of time, there were a lot of well-intentioned efforts to help populations, to help people out there. And then there were problems as a result of those efforts, multi-stakeholder corrective measures to right the past wrongs that further led to unintended consequences. And that cycle continued on and on and on. And as we have it today, the opioid crisis and as it manifests today is something I began to learn as I began my journey in my career path as a physician. And so my last stop was Albuquerque, New Mexico in my fellowship for pain. And I didn't even realize that the I-40 interstate that connected the two cities would also have an important part in the story of where we are today. And so what I came out to New Mexico for fellowship was to learn about this condition called chronic pain. And the Institute of Medicine in 2011 gave us a report that basically illustrated that this was a bigger problem, chronic pain, than we had ever imagined. It was a $600 billion problem in annual expenses and lost wages. So if you can take coronary artery disease, cancer, and diabetes combined, those three disease sets, which the medical community has a lot of training in, if you add those up in annual medical expenses and lost wages, it would not equal chronic pain. But the medical community does not have a lot of training when it comes to the condition of chronic pain. And so back in the late 1990s, there were federal initiatives to treat pain very seriously, and these were well-intentioned efforts. And so we equated pain treatment with pain pills, and this caused a whole cascade of problems, including entrepreneurship amongst clinics and pharmaceutical companies. And this really kicked off the prescribed opioid epidemic. And so when we took a look at some of the problems here in East Tennessee, per capita, we became quickly one of the worst in terms of those who were affected by the opioid crisis in the entire country. And so it begged the question, as I started my career here, why? Why in particular East Tennessee among all the places around the country, why is it worse? And so really looking back culturally, we have to think about another set of immigrants, the Scot-Irish, that came over here hundreds of years ago for similar circumstances as my own parents, looking for a better economic opportunity, coming over here, trading mountains for mountains in order to feel like they're going back to some place that's similar to home. And with them, they brought whiskey technology. And whiskey provided a way out for a lot of people when you don't have a lot of resources, when you don't have a lot of financial opportunities. You can use whiskey as a way to make money and also to kind of cure what ails you. And deep within our culture, here in East Tennessee, we can look at our fight song, Rocky Top. When we think about where we get our corn from a jar, essentially. And also in the lyrics is something else that's a little bit kind of sight unseen, this idea that you have a particularly ambiguous relationship with the law. So those in the lyrics, two strangers came from Rocky Top looking for a moonshine still. Those two strangers never came down from Rocky Top, reckon they never will. And really what they were talking about in the lyrics were revenuers, the first people to actually tax whiskey. And what happened to those those revenuers is that they never came back down from Rocky Top because the people in Rocky Top didn't want them to take their money. And so also deep within the culture is this idea of cars and roads. And so when you are trying to get your commodity out to the big city, you have to take these small roads. You have to drive fast and outsmart the law, and you have to bring your wares to cities like Asheville, Knoxville, Atlanta in order to make money. And this is lampooned in The Dukes of Hazzard, where you have two good old boys being chased by the law, outsmarting the law, driving really, really fast in their cars. And its historical vestiges are also in NASCAR, North America's largest spectator event. But from the whiskey rebellion to the Civil War to clan feuds to Prohibition, whiskey has always been there as a means of resources for people that didn't have a lot. But when Prohibition ended, alcohol was no longer a commodity that was nearly as profitable. And so corn doesn't grow at all on Rocky Top, but there is another commodity that does, and that's marijuana. So as Prohibition ended, you no longer had a product that was nearly as prized, in essence, and then now you had to look for another means of making money through another illegal product. And so ever since Prohibition and up until the early 2000s, marijuana was the #1 cash crop in a lot of the places in eastern Kentucky and in southern Appalachia, here in East Tennessee. And here's a quote from a law enforcement agent that in Daniel Boone National Forest back in 1991 that said, "This is because of the remoteness of the area, the level of poverty, the lack of jobs, entire communities revolve around this illegal product." Sounds pretty familiar. And so the highway systems, again, as the 2000s arrived, became more of an important player. So I-75 transects Knoxville along with I-40. This highway system connects Detroit all the way down to South Florida, and that becomes important later on. As the 2000s arrived, we had this initiative of taking pain very, very seriously. And then nefarious entrepreneurship began and grew out of South Florida. And what law enforcement officials began to realize was that in these particular areas, a lot of the license plates that came into these clinics were not just from Florida, but they were from places like West Virginia, East Tennessee, Western North Carolina, Northern Georgia, Southern Appalachia. And so what really became a major issue as I was starting up in my career in 2009 was this whole idea. Not only did I see a lot of people that were on opioids that really never needed to be on opioids, but what became more pressing, more alarming to those people that were in policy, that were in law enforcement, that were also in other parts of the medical community, was this idea of neonatal abstinence syndrome. And it was the first time where policymakers were really starting to take notice, because quickly we were becoming national leaders in trying to wean babies off of opioids that were exposed in utero. And the number of people that were dying as a result of prescribed opioids were only growing. And so as policies started to develop guidelines, education efforts, and other resources to drive opioids down, paradoxically, what we also began to see was an increase in the deaths in our area. And so as prescribed opioids were decreasing, the one thing that we started to notice was that from Detroit, that same highway system, we saw heroin and the fentanyl derivatives come into this area, and the number of people that were dying were at higher rates, because now you had an uncontrolled drug that was more potent, killing a lot of the people that were previously addicts from prescribed drugs, now taking something much more dangerous. And so essentially, when we think about the moonshining roads, we think of Thunder Road, when we take our wares from the holler back into the city. And now what we were seeing was that we were taking drugs from the city back into the holler, and we were essentially seeing Thunder Road in reverse. But there was something that really bothered me about the narratives about prescribed drugs and opioids in general was that the chief medical examiner reports were also talking about something fundamentally different from what the narratives were talking about. The reality was that a lot of people were dying from multi-drug use, polysubstance abuse, not just one drug in particular. And as we drove down one drug, we would sometimes bring in another that was much more dangerous, but we would also not account for all the other drugs that these people were also taking. And the other portion of this was that there was also an issue of suicide in our area. We're at a 30-year high. Tennessee is now seeing teen suicides on the rise. And life expectancy for the first time in 30 years in the United States was actually dropping. And it was largely because of a lot of different factors. A report by Case and Deaton took a look at some of the 30,000-foot view economic factors that were involved in some of these discussions about why people were dying. And part of the discussions were that there was a lack of jobs in particular areas, a decrease in marriage, a lot of other social factors that were predisposing non-Hispanic whites to early death. But also, in particular, opioids, alcohol, and suicides were the three main culprits. But I thought that this quote in particular by Deaton was very, very important. We think of opioids as something that's thrown petrol on the flames and made things infinitely worse. But the underlying deep malaise would be there even without the opioids. And so as these policies were being placed into the nation and also into the state, my fears were that doctors who were inundated with the dangers of prescribed drugs and feeling the pressures with prescribing opioids were now going to stop prescribing altogether, and those who were caught in the middle would be the chronic pain patients. And that's exactly what we're seeing today. And as a way out, there are some patients that are turning to suicide and illicit drugs to treat their legitimate pain issues. And so when we're thinking about this entire issue, we wanted to go away from the 30,000-foot view and take a look at those individuals that might be, why those particular individuals were really at risk for anything that was all related to this decrease in life expectancy in the United States. And in particular, some of my thoughts and some of my research kind of drove me towards this idea that adverse childhood experiences are part of the narrative that is essentially missing. And in reality, when we talk about adverse childhood experiences, and we break it down into three fundamental categories: abuse, neglect, dysfunction in the home, that if we don't start talking about this problem that we have today in these very specific terms, that we will be misallocating resources to the true nature of the problem. And really, physical, emotional, sexual abuse, physical, emotional neglect, and all these dysfunctions in the home are critical in understanding a lot of health outcomes. Really, those who experience trauma early in their life are 15 times more likely to commit suicide. They're more likely to take any type of drugs, including alcohol. They're more likely to be depressed, more likely to smoke, more likely to fail financially, having serious job problems, being absent from work, and the like. And so also these ACE scores were found to be dose dependent. So the more of these traumatic events that you experience early in your life, the more likely you are to have a whole host of poor health-related outcomes, not just suicide, addiction, and so on and so forth. And so why is that? Well, it turns out with the stress of trauma in your life, that there are toxic hormones, and this toxic stress can actually fundamentally change the architecture of the brain. And so those critical portions of your brain where you're able to make good decisions, rational thoughts, and be able to better cope with certain stresses of life are diminished with the onslaught of chronic stress, and the architecture of your brain will fundamentally be changed for the rest of your life. And so when we're talking about adverse childhood experiences, you're talking about the disruption of neural development and social, emotional, and cognitive impairment, and all of these poor, risky behaviors that lead to ultimately early death. And so one of part of the conversations that I've had with those who are dealing with this at the street level as far as the opioid crisis or the trauma crisis as we know it today is that People will run from one drug to another just to find something that will make them feel better. And as we see it today, there's an explosion of methamphetamine and cocaine and a whole host of other drugs that are being abused, not just the ones that we are accustomed to seeing in the narrative. So why is that? Why are these people running to these other drugs? In reality, it's this idea that some of these people are compulsively trying to find comfort where they've never had it before in their lives. They're trying to feel better, feel differently from the traumas that they have experienced, and that is fundamentally missing from the narratives altogether. So my wife and I, we both love the mountains. My wife is from Corbin, Kentucky, just up I-75 in the heart of eastern Kentucky. And her father is also from eastern Kentucky in an area called Harlan. Harlan has had its own problems with drugs, loss of economic opportunity, violence, alcohol, you name it. And so when you get two people together from the mountains, this happens. And so when we're talking about where we are today with today's crisis, I'm going to want to quote an often used slogan for the trauma community, and we should stop asking what's wrong with the individual that has been taking these drugs or who are addicted, and we should start asking what happened to the individual. Because if we're talking about the future of mountain people in the world, like you see here today, we want to create conditions where they have experience of resiliency so they don't just survive in the mountains, they also start to thrive. Thank you.